Hi nurses, it's Travis with Aureus Medical. Today we have our clinical corner where RN Betsy Martin and I will be chatting about patient violence towards nurses. So thanks for joining us today, Betsy, and let's dive right into it. So what's the current situation with workplace violence towards nurses?
Well, workplace violence towards nurses has been around for years. Recently, though, we've seen a huge increase in these incidents happening. There was a study done in Virginia with 700 nurses recently, and 76% of those nurses said that just within the past year, they had been abused physically or verbally. So the numbers are really growing. Some people attribute that to our lack of mental health care facilities. A lot of those have been closed. It used to be that they would take those patients to those facilities that were very well equipped to handle those situations. Now they're just being taken to our emergency room and they're just kind of mixed in with the general patient population. Also, the opioid crisis is having a huge impact on this. A lot of patients are coming in withdrawal and they're seeking drugs, narcotics, and sometimes they can resort to violence, unfortunately. So it's really becoming a major problem.
How does this affect nurses in healthcare today?
It has a huge impact on nurses and the whole healthcare industry. Obviously for nurses, there's physical abuse involved, there's emotional abuse. A lot of our nurses have PTSD if something like this can happen. There's also a huge effect on not just that nurse, but the whole unit and the whole hospital. Employee morale can be changed. People can be fearful coming into work. And it has a huge financial impact too. So, it's a huge cost with absenteeism, increased workers' compensation cost, employee turnover. So it has a huge impact throughout the entire industry.
So what is being done with workplace violence towards nurses?
So right now there aren't any federal laws protecting nurses towards workplace violence. There is some legislation that's going on right now that could make it a felony to abuse a nurse, much like what's already in place for police officers, but for right now that nothing has been passed. There are state laws. There's 41 different states that have increased penalties for injuring a nurse. However, out of those 41 states, some of those states only apply those laws to certain parts of the hospital. So it may only apply to ED nurses, psych nurses, or public health nurses. So it may not protect all the nurses in the hospital, and we all know that violence can happen anywhere. The Joint Commission and the ANA agrees with this as well, is they require their facilities to have a culture of safety. And they have to have programs in place to support that culture of safety. However, it's up to the individual facility on what that looks like or how they implement it. So there is some protection in place, but not nearly enough as what's needed.
So what can nurses do about it now?
So I would say educate yourself is probably the most important thing. And there are a lot of certifications and courses out there available. The CPI, or the Crisis Prevention Institute certification, is kind of the gold standard for this. A lot of hospitals require their ED or psych nurses to already have these certifications. So that can be kind of an expensive program. There are a lot of cheaper options on the internet, a lot of smaller courses you can do. Also, there's a course on the CDC's website that is absolutely free. And it's actually pretty deep in depth on how you can do to protect yourself. They cover everything from verbally de-escalating a situation before it turns into violence, and then it also covers physical defense too, if you would need to resort to that. Also too, I think it's really important for our travelers, because they're kind of bouncing around between different facilities, is when you get to a new facility, know what resources are available, know what their procedures are for safety. Before you even hit the floor, know security's number if you need to call them. Know who you can go to or who you should go to if you see a situation escalating, and where can you go for help. A lot of hospitals will have a code gray, and that's if that's called over the hospital speaker, it means there's some type of violent situation occurring somewhere in the hospital, and you need to know your actions that you're supposed to carry out if that should ever happen. And And I would really encourage everyone, if this has happened to you, ideally you want to immediately report it to your supervisor. You want to go to employee health and get assessed, and file for workers' compensation if you would need to. Sometimes you may not feel like the injury is that big of a deal, but later on it can become a major problem. So you want to address it immediately and tell someone immediately. Also let your Aureus account manager know too. We can help you with a lot of resources, and we want to make sure that you're protected and supported.
Thank you so much for that insight, Betsy, and thanks for tuning in, nurses. If you have any additional questions or any additional comments, feel free to call us today, and we would love to be that additional resource for you. Have a great day.